Hi, I'm Jane Drake, and I'm here to talk about my plastic surgery experience with Dr. Engel. And it was a little bit of a long journey. Took me almost a year and a half after I met him to actually have the surgery. How I found him was some friends went to the information just you could just come. I mean, they just said come to Sarasota Plastic Surgery Center, meet the doctors, learn about plastic surgery. And I went with two other girlfriends, always thinking about my neck because I had a saggy neck. And I felt like my saggy neck was premature for my age. And we also went to a couple other plastic surgeons that are local, and they were all very good, but I really liked Sarasota Plastic Surgery Center. I liked that you had the surgery there on site. And I really liked Dr. Engel. His energy, I liked him. I mean, there was kind of that connection because you got to meet all of them, but that's who I liked. I did like his youthfulness, and then meeting him, he's just a really nice guy, very conscientious, and very realistic, and it was a good experience. But then I put it off for a while because you start to think you're being too hooked up in appearance and everything else. But it got to the point where I'm like, I just need to do this. And I scheduled my surgery for January, and it's now August. So my experience with the surgery and the center, the people there are great. And it wasn't a big deal pre-op or anything like that. It's not complicated. The biggest thing that you have to really take into consideration, which you don't think, is what post-op, like getting your bed ready. You got to get the pillows ready. You got to have a comfortable place to sleep. You got to realize you're going to probably be sleeping on your back. You know, I sleep on my stomach. I'm not, just things like that. Just making sure you have the water and the juice. Like, they give you all those written instructions, but I guess post-operatively, don't be so focused on the surgery that you just blow that off. Make sure you take time to do that. Pain, I think I took 2 of the prescription pain medications with my neck, and I also had fat injections in here. Okay, not a lot of pain. The dressing, you wrapped like that. Okay, you have drains. It will feel tight. That's a given. The drains came out. Not real painful. You go back first thing in the morning. That wasn't horrible. Did I tear up and start to cry? Yes. Was it because I was in a lot of pain? No. It's just, I think the emotions, the anesthesia, that affects everybody different, and that's what it did for me. The consultation, I went by myself, and he was kind of cute because he's looking at me going, okay, so how can I help you? kind of deal. And I'm like, my neck. And he goes, oh, okay, I got that. I can help you with that. Because he was very kind. He was just kind of like, you look really pretty good, and there's not a lot that I could, do to make anything look better. But your neck, he's like, I have that. I got that. I see what you need and what you want. And to be honest, I had wrinkles all the way down to here. So the idea that you're going to pull all of that up, I mean, he said, I'll do the best I can to make it absolutely as good as I can. But that's, think about that. I had skin folding down on here. So he was just very thorough and what the outcome would be. Like, he was realistic. I knew he was going to do the best he could do, but I knew I was still going to have some rings because that's what I've always had, and that there still could be some sagging down here, which there isn't though. I mean, there isn't. But he said to me, I don't know, I'm going to do my best. And he did. And I took so long to make my appointment, I went in for a second consultation actually to review. I don't think that's that uncommon, but if you wait too long, you got to go back, and I did. Same kind of thing, and no big changes. It wasn't a huge decision, but that shows you how thorough he was. He was going to see me again, talk to me again, and make sure we were still on the same page, and we were. Day of surgery, of course, it's the crack of dawn. I mean, it's early in the morning. You get someone to take you in. You wear comfortable clothing, all that kind of stuff. You haven't eaten anything. I mean, you walk in, you sit down, they take some information from you, and you put on a gown, and the next thing, I mean, you remember is you're out. By the time you're wheeled into the operating room, you're done. And the incisions, there is a little something here, but you know what? I mean, that wasn't anything I ever really felt or noticed. For the neck lift, it's really, for me, it was behind the ear. That's how much skin he had to pull. So that was my thing. I had to go back and have staples removed. And I was actually pretty worried about the staples coming out because I'm a retired nurse and I know staples can be uncomfortable, but the young woman who took them out, I didn't feel a thing. I really didn't feel a thing. Because I was prepared to scream so they could hear me down the hall. That's what was going on in my head. But no screaming down the hall. Came out really well. But yeah, I had the staples back here, and I had to take care of them post-operatively. You go back for checks frequently, you know, so they check all that out. They checked for swelling down here. That's a big deal. But, you know, obviously it went well. I remember waking up and my daughter was reading a book next to the bed. And so I woke up at about 5 o'clock in the evening. I left the center, I was told, at about 3. I don't remember leaving. I don't remember being dressed. I don't remember being in a wheelchair. I don't remember the drive home. I don't remember getting into bed. I just remember waking up. I didn't remember waking up because I was in pain. I just woke up naturally because I woke up. So you don't eat or drink a lot, just a little bit of fluids. The big thing with being comfortable, I mean, you're still groggy and kind of whatever, so that wasn't a big problem, but it is getting set up on the pillows. It is, you know, the elevation and being comfortable that way, and just also sleeping on your back. The next morning I went back. My son, actually, my teenage son, drove me back in the morning to have the drains taken out that were back here, one on either side. I did take pain medication for that. I took pain medication prior to like getting my staples out. If I was going to have a visit and they were going to do something, I did take my prescription pain medication, and or when it was farther out, I made sure I like took 2 Tylenol. So, and I did have to take care of my little staples back there. That wasn't a big problem. You know, you're eating soft food though. You are drinking and a lot, so you want to have things you like to drink around. I actually went out for the first time. My friend got me to go out, I think 12 days after surgery. I went out in public to a restaurant. And it was still a challenge to eat though. Like I still had to eat soft food. Like you couldn't eat a steak. I still couldn't eat like a steak or anything kind of like that. I still found it a challenge that way. Horrible, no, but I mean, practical, you just have to think about what you're gonna eat. I don't know what to say on that. That's just, yeah, I can't believe I did that, by the way. I cannot believe I did that. She was persistent. I went back to doing yoga 3 weeks after surgery. I couldn't do all the neck extensions that you do with yoga. Anybody who knows yoga, you get kind of you can go back to exercising and stuff about 3 weeks, depending on what you have done, of course. With Dr. Engel, like I came in with my daughter once and I brought her in again and he remembered her. And he even remembered where she worked. He just connects with people and it's in a very genuine way. And as far as surgery, I know that he's a perfectionist and he will go the extra length to make it how it needs to be. So I said to him when we were talking about for the fat injections and everything, I just said to him, do it like you think is best for me because I know you know, and I know you want me to look great. And, you know, I just felt like you can trust him that way. You can, tell him what you want, what you need, what you think, and he will respond in kind with doing the best that he can for you. What I love about Dr. Engel is how much he cares about you, what you want done, what your expectations are, and making the outcome be as close to the ideal as possible. He exceeded my expectations with my neck, and it's just like I would trust him for anything. He's just a really sincere and wanting a realistic and outcome without, looking too scary. Let's see, I'm almost healed, not quite. It takes a while. This is August. I had my procedure done in January. Everybody's different, but to me, I look upon that as that's how extensive he was in trying to fix my saggy neck. I mean, that's how I see it. It looks good. Looks good, doesn't it? I don't know what else to say.